A week from today, San Francisco's COVID-19 public health emergency comes to an end. It's the same day California's COVID state of emergency also expires. And while public health officials say it's time for these declarations to end, not everybody thinks that's such a great idea. ABC 7 News anchor Liz Kreutz joining us live in the newsroom. More on the message. Liz?
Hi, Larry. Yeah, for public health officials, the end of this health emergency is really an acknowledgement that hospitals are not being overwhelmed anymore because of COVID. But we spoke to people dealing with long COVID and other impacts from the virus who have concerns about this next step. They say the pandemic is still very real.
It's airing across the state, a COVID treatment sing-along commercial from the California Department of Public Health, showing people of all ages and ethnicities singing and jumping around about ways to beat COVID. But as public health emergencies come to an end, some say the virus is no dancing matter.
I don't want to sugarcoat anything. Having long COVID is like a nightmare.
Olivia Harris is a 27-year-old woman with no underlying health conditions who for 8 months now has been dealing with long COVID after being infected last June.
I've had fatigue, I've had really bad body and muscle aches, some gastrointestinal issues, and I was kind of surprised to be experiencing all of these because, we've kind of been told that COVID has become kind of a cold.
Harris says she had to drop out of grad school and move back home with her parents. She hasn't been able to work.
There's just so much confusion.
Kristen Urquiza is the co-founder of Marked by COVID, a group that advocates on behalf of people impacted by the pandemic. Her father died of COVID in 2020. Urquiza and Harris are both raising concerns as San Francisco's public health emergency comes to an end next week.
Even if the emergency ends, there's still a crisis. We are about to lose a ton of protections that have been keeping San Franciscans afloat.
Urquiza says housing protections, paid time off for COVID, and food benefits are all in jeopardy.
How we measure the phrase emergency is around severe disease.
UCSF's Dr. Monica Gandhi explained that the end of the health emergency does not mean an end to fighting COVID.
The phrase emergency has to actually be attached to hospital systems being overwhelmed. It actually doesn't mean that COVID's gone. In fact, unfortunately, COVID will never be eradicated.
Still, Harris and Urquiza hope people don't get the wrong message about the future of the virus.
I don't think that the general public really understands how bad it can be.
And I also spoke to another young man here in San Francisco who is homebound with long COVID. He believes the public health emergency should not end until there is a treatment for long COVID. And right now, as we know, there isn't one. In the newsroom, Liz Kreutz, ABC 7 News.
So Liz, what exactly does the end of the public health emergency actually mean for residents in San Francisco, let's say?
Yeah, right. So, the city has not released specific details on what the end of the health order means for certain COVID-related protections, like housing, for instance. Mayor London Breed, however, did tell Kristen on Getting Answers yesterday that COVID-related sick pay requirements will be coming to an end, and mask requirements in certain settings like hospitals and homeless shelters are also ending. Larry.
Interesting. Liz, thank you.